My name's Randa Bush, and I have worked for Newvista for going on 10 years. Newvista, we recently had a name change back in July. We were bluegrass.org, and now we are Newvista. And we serve our community. We serve 17 counties, and we provide mental health, behavioral health treatment, substance abuse treatment, and we work with those with intellectual developmental delays. We usually talk about mental health in terms of behavioral health, so that includes working on how we think, feel, and act, and when we have struggles with that, and then also if we're dealing with any kind of addiction or any type of recovery. So we combine behavioral health to include our mental health and our substance use services as well. Teens are very anxious and stressed out. There's a lot of demands that are on them. So anxiety has always been prevalent. Then we have the mood disorders, depression, or dysthymia. We see that as well. And I would say another one that is pretty common is just conduct or behavioral type of disorders, ADHD, or the other disruptive behaviors. I think it's getting noticed more now, which is good, but I think we're catching up, and that is probably trauma. And there's just more awareness now around the idea that a lot of teenagers have experienced some type of trauma in their life, whether it was in childhood or currently. And so in the past, I think we did a really good job of identifying the behaviors that were concerning, but we might have seen them as ADHD. But now we're realizing, hey, that was really trauma. So it presented a lot of the same type of behaviors, hypervigilance, lack of attention or focus, but we weren't as aware of the harder questions that needed to be asked about what's happened in their life that might make them present that way. So I think we're doing a better job of it now, but we have some catching up to do. It's just recognizing that adverse childhood experiences and trauma are playing a role and an impact in our teens. So I think it starts a lot with just kind of poor boundaries around sleep, time, like how they're spending their time. Sleep is a big one. When you talk to the average teenager and ask them how much sleep they're getting, it is not very much. And so when you're running off of a low amount of sleep, and the teenager actually needs like 9 to 10 hours of sleep that they're not getting, that impacts your mood, that impacts your relationships, so that's a big one. Then just balancing time. You know, there's a lot of time demands on teenagers, starting with their school day, which is like work to them, right? They're showing up for school. And then a lot of them are in extracurricular activities, maybe like a sport, that demands time. And then a lot of them have a presence on social media or with their social group, and that demands time. And so poor boundaries around time management and just feeling overwhelmed and stressed. So we see that as a big contributing factor. And then just the basics of like taking care of yourself, getting a proper like nutrition, like eating regularly. Like students will go to school and not eat lunch because they prefer not to eat around their peers or something like that. And then, or then maybe they didn't even eat breakfast. And so they're just imbalanced in some of the most basic ways that kind of get us dysregulated and throw us off. And so I think those are all contributing factors, along with the high demands of just time and stress. If a teenager feels like they have a trusted person they can go to, it doesn't have to be their parent, but if it is their parent, that's great, because we see that a lot of research supports that if you have a trusting relationship with a parent, that reduces outcomes for negative outcomes. And just if not with a parent, then with another trusted adult. It could be a coach, it could be a scout leader, it could be a pastor, anyone that they can go to if they're just needing some support and guidance and they know that person cares. So if you're at home together or in the car together, be present. Like, don't be on the phone talking to someone else or just kind of checked out. Like, be present and show up when you're with them. That's huge. And I even noticed that myself as a parent, is that sometimes I have to just put my phone down, right, and talk to my child and get down on the floor and play. Like, showing up is huge. And then listening, asking questions and listening. I think a lot of times teens stop talking to their parents because at some point they felt like if they were to share something that instead of the parent listening, they were going to get like a lecture or a response that was lengthy and or harsh or not understanding. And so then they stop talking, and we just never want to stop the conversation. So I think for parents and those who want to help teenagers is just being good listeners and hearing what they have to say and letting them process, because they're in such a developmental stage right now that if we can help them process and think critically, is going to serve them so well throughout their life.